In presenting this DVD, I am assuming the viewer is familiar with standard transducer positions and movements, as well as orientation of organs on the ultrasound screen, as presented in the Tips and Techniques DVD. I also encourage the viewer to optimize the ultrasound image for your ultrasound machine, as described in the Tips and Techniques and General Abdominal Scan DVDs. After examining the caudal stomach wall and the left limb of the pancreas, the spleen is the next abdominal organ to examine during a general abdominal scan. Interpretation of ultrasound findings of the spleen requires some knowledge of splenic function. On ultrasound, the splenic capsule is a thin, smooth, hyperechoic line. The splenic capsule and the trabecular system attached to the capsule contain smooth muscle cells that can contract to force red blood cells stored in the red splenic pulp into the general circulation during times of exertion, anemia, or shock. The process of contraction helps raise blood pressure during anemia or shock, as in this 12-pound Papillon presented with weakness, collapse, and shock as a result of an Addisonian crisis. The smooth muscle of the capsule can also relax and stretch, allowing blood to be stored in the spleen during times of congestion or inactivity. Stretching to fill with blood helps to lower blood pressure, as in this 11-year-old, 45-pound dog sedated with acepromazine. The red pulp of the spleen phagocytizes old red blood cells and helps metabolize hemoglobin. The white splenic pulp contains nodules with functions similar to lymph nodes. On ultrasound, the red and white splenic pulp appear as homogeneous, finely textured splenic parenchyma, slightly more echogenic than spleen. The parietal surface of this normal cat spleen faces outward towards the muscle and skin of the abdomen. The visceral surface faces inward toward the abdominal organs. Splenic vessels and nerves enter the spleen at the hilus on the visceral surface. The spleen can be differentiated from liver by the presence of veins crossing the capsule. In the liver, the veins remain inside of the capsule and join the caudal vena cava dorsal to the liver. The head of the spleen is in the left cranial and lateral abdomen, usually cranial to the last left rib and attached by omentum to the lateral stomach wall. The head of the spleen is usually thicker or blunter than the tail of the spleen. The tail of the spleen tapers gradually away from the main body. The tail of the spleen is not directly attached to any organ and can be located almost anywhere in the abdomen. It is a common error for beginners to identify part of a folded spleen as a tumor. The ultrasound beam crosses two parts of a folded spleen. Move the beam by sliding the transducer to follow the spleen till the two parts connect.